afternoon, everybody. We're going to finish with our final panel for the day. So, is it on? I think it's on. Yes. Yeah. I think we're good. So thank everybody for their participation so far. It's been a really rich day with lots of fantastic discussions and topics. And in our final conversation for today, we're going to talk more about community-based approaches. We've started some of those conversations in the morning. We've had some examples throughout the day. I won't go over again kind of social norms. I think we had a very rich discussion this morning on the social norms and how they influence our lives, how they influence what we do, how we have access to education and resources and other things throughout society. We also talked about how norms are changing continually. They're not static. And then as we talk about community-based approaches, they're important because they're tailored to local realities. They're tailored to local language, literacy levels, cultural values and beliefs, gender norms, family structures, religious traditions, etc. So we're delighted to kind of have our last final speakers talk from Promundo and Tostan, two successful organizations that have community-based approaches that promote social norm change and are aimed at reducing different forms of violence in the communities where they work. And so just a little bit about both of these organizations. Promundo is a global leader in promoting gender justice and preventing violence by engaging men and boys in partnership with women and girls. They believe that working with men and boys to transform harmful gender norms and unequal power dynamics is a critical part to the solution to achieve gender equality. For the empowerment of women and girls, we must engage men and boys in those solutions. And men and boys are also benefit when these harmful traditions are addressed, and also promotes equality for women and girls. By engaging men and boys, they promote healthy masculinity, what it means to be a man, and femininity, and what it means to be a woman, and that this leads to improvements in men's own lives and the lives of women and girls. And we have Magaly Marques from Promundo, who is their new deputy director in the United States here. And Tostan empowers African communities to bring about sustainable development and positive social transformation based on respect for human rights. They believe that through this mission, they can ensure that every person, every man, woman, boy, and girl, is able to live a life of dignity. And their community empowerment program model respectfully engages communities by working on their own languages and traditional methods of learning. Facilitates community ownership over the development process, allowing communities to fulfill their own potential. And this approach has been extremely successful in addressing harmful traditional practices such as child early and forced marriage and female genital cutting. And so we're pleased to have Gannon Gillespie here, Tostan's Director of Strategic Development, to engage in that. So we'll start with Magaly, please. Okay.
We were considering staying seated. Hi, everybody. It's been a fantastic day. I think I learned a lot myself from the day. Let's see if, do you know how do I get to my presentation from here? No. What? Yeah. Here we go. No, that is not. It's making people hungry. Yeah. Now I just use this. Yeah. There you go. Okay. Now I know. Now I think I got it. Okay. So of course, social norms is the topic of the day. I will be talking about the work of Promundo towards gender equality and peace, especially gender-related peace, in relationships. So Promundo has been working for over 10 years now in the intersection of research and community-based interventions involving men and boys in trying to address, from a critical thinking perspective, the root causes and the social norms around gender, masculinity, and relationships and power dynamics in those relationships, and trying to learn from that how to improve those programs, on-the-ground interventions, as I said, around the world. We started in Brazil, and we have gone to many different countries piloting new initiatives with innovations and trying to rigorously measure the impact and the learnings so we can share with the community that work with not only with men and boys, but with gender equality issues in general. So what I'm trying to bring to you today here is a bit about what we have learned over time, what we found out that we need to learn more, what needs to be studied more in this area, and what our next challenges personally as Promundo, the way we see coming in the next few years. So the way Promundo has been working with men and boys, especially based on our pioneer project, Program H. As most of you know, H stands for the word in Spanish and Portuguese for man, homem or hombre. And it has been a very powerful model that has been shared with other countries and adapted accordingly. And it's based, as Arturo had highlighted in the previous panel, not the previous, about one of the takings of today's discussion about the social ecological model, where the individual is not cannot be taken away from its environment, and the set of policies and structures and systems in which that person functions. So we try to work with the individuals in group settings, in critical learning about what has already been learned by that individual over time through life experiences and, in observing and from the culture, trying to expose the individual to new models, new ways of being, and try to, to some extent, help individuals understand what has been internalized, understand that things can be different, and try to propose new models that, they can be rehearsed over time, and, at some point, perhaps lead to changes in perceptions, attitudes, and eventually behavior. So to make that a little more clearly, so the Program H that then was adapted also to be worked with women, with diverse, with LGBT youth, has been going on for, as I said, for 10 years, more than, I think at this point we're like in almost 25 countries. It has been translated in different languages, and that was done always very carefully in a way that would protect the core of the program so we wouldn't get lost, and that we could continue to evaluate the interventions as we move forward. So it's based, group education focused on the, as I said before, critical reflection about their patterns as men, what it means to be a man, what it means to be a young boy, to grow up and be a real man. So all those questions are analyzed and are discussed in group settings. In some cases, we have brought elders to, work with the young people. We did that in Brazil, and it was very powerful to have like a grandfather figure come to the group and say, yeah, when I was your age, I believed that too, that to be a real man, I needed to do this, this, and that. And now I see it's totally irrelevant. And that was a powerful thing to help the younger generation see, well, I don't need to really go with the assumption, of certain behaviors, now that I see the older generation regretting some of those behaviors. But that's just one piece. We haven't done that in every single setting. So the program has been used in schools, in recreational centers, in community-based organizations in different ways. It uses a very participatory methodology based on the Paulo Freire's approach of adult learning and empowering, and it's a combination. In most settings, the main focus is HIV prevention, sexual and reproductive health, intimate partner violence, violence in general, and mental health, and what well-being means for men and for women, family and personal relationships, in a way that trying to analyze violence and how it gets, infused in the private life from the outside settings. Most of these young men are from very impoverished communities where violence is a day-to-day reality, and so it's very easy to forget the boundaries and assume that it can happen also among people you know and care for. So one of the themes that Promundo works with men is about caregiving, being a caring partner, trying to resurrect that ability to care from inside men, as opposed to what's highlighted most of the time for boys growing up, and for men in general, that it's the assertiveness, the aggressiveness, the taking space, and so on. To measure these activities and to try to know what works best and why the program has been successful, we have worked with other partners. Primarily, the Population Council was one of our partners over time to develop the Gender Equitable Men Scale, GEMS, that has looked at how we can work with adult and young men in figure out what these measures would be, to try to demonstrate what's, as I said, the core principles of the program that can predict, change in the way the program is intended to. Also, another point of success for the program is that it's easy to implement, easy to administer. The curriculum can be translated and adapted, and it has been received very well in different countries. So that also speaks to its success. So what we learned from 9 evaluation studies in the 8 countries, and it still continues. It's moving forward in 5 different continents. And what we've seen, despite the fact that these were very different countries and different settings, is that systematically there was, after the intervention, less support for what we call the inequitable patterns of masculinity, and an increased support, for adopting more, more equitable patterns of behavior, so to speak. One thing is not the same as the other, so we just want to highlight that both happen. In terms of health behaviors, we saw more condom use, because that was, the way it was framed to look at care and intimate partner relations, for instance, in supporting the prevention of STDs. And violence against, intimate partners was also, had changed between the baseline and the end line. So that was very promising to find that in different settings. So what we learned is that by coming up with an innovative approach, and from the get-go, from the beginning, studying it and piloting, and as we changed and adapted for different community-based settings, we were able to learn as we move along and build these scales that now it's the only one that exists that is being able to offer some evidence base for work with men and boys. And we are seeing changes in attitudes associated with the self-reported behavior. We know there are challenges in that area, but that was what we could rely on up to today. And we have seen also that attitudes are important in the change, although sometimes there's an emphasis on seeing change in behavior, especially when we working on the health industry. We want to see quickly something that we can determine that changes behavior, be it condom use, contraceptive use, or whatever. But sometimes we tend to minimize evaluations that focus on the change of attitudes. What we're beginning to see is that the change in attitudes and perceptions and beliefs is very important to get to the change in behaviors. And that so one thing is related to the other. And the other is that the attitudes associated with gender are very also connected with education and knowledge. So the more knowledge and awareness about risks, health consequences, not only health, but in terms of relationships and future opportunities for boys, also helps them change their behaviors towards the other gender. So another research that we have done recently, it's the image survey that we took to very different countries around the globe, and it's still going. These are the ones that have already been completed. We are already starting in 3 other countries and going to move forward depending on our ability. To fund them. So what we have seen from the image is, which was a households survey with men and women, but focused on boys and men behavior. And it added to what we had already learned with the JAM scale, because it showed that while being in an intervention, learning from the process of participating in that group debate that the Program H offers, produced, change in attitude. There is a limitation to that, excuse me, when there's a living experience of violence. So witnessing in childhood intimate partner violence or being sexually abused is a powerful element difficult to overcome from a program perspective. So that it has informed our work moving forward, that we need to work on the combined arena of changing awareness, bringing the education, but also in the cases of lived experience, there needs to be some more focused interventions to address from the emotional, psychological background, the limitations of overcoming what the impact of that experience. So those are the areas that we figured we need to focus on moving forward. Parent training, fatherhood. We have been working on fathers and fatherhood campaigns for a long time, but we see that there's more need to prepare men to the task of being a caring father. So to just exhort them to, you have to step up to the plate and share with, your partner is not enough. There needs to be a development of skill sets. In some places we see that women go through that prenatal care type of, experience, not only from the health perspective, but sometimes in learning, how do you breastfeed or how do you do this. Men don't get that teaching, that education on how to be a caring father. So we need to conceptualize and develop what we want to really happen on the positive. As we heard in the morning, there's a lot of emphasis on what is wrong about male behavior, what is negative, what is destructive, and there's plenty of that. But if we want to build and make it become a reality, we need to make it visual, make it clear, and create the means so men can engage in those things and say, well, okay, so I have to do X, Y, Z. That's what it means to be a caring father. So that's one area. As I was saying, the psychological support for those who have experienced or witnessed violence, firsthand, especially in childhood, which is very difficult to undo, and trying to study more the linkage between, and that this was discussed earlier by other panelists, gender-based violence and other types of violence, to see if we can learn from those different types of violences to see any correlations. Especially when it comes to education, and how education, different types of education can lead to less violent behavior on the basis of understanding some patterns. Another challenge that, in doing research that we're going to face is, as I mentioned, the bias in self-reporting. We haven't been able to figure out another way of doing that, but we know there is a bias, especially, after the intervention, they figured, oh, I know what they're expecting me to answer, so here we go. So although the questions are, in negative and positive, and they're all jumbled together, and they're all the very clever ways of preparing the surveys, it's still a challenge. We also need to understand how to measure social change in a community setting. What does that mean, not only for the individual, but sometimes the individuals may be having a difficulty overcoming certain situations, but we have already created enough of an impact on the group that over time will prove to have a counter impact back on the individual and so on, which is also a challenge that and will help us in taking things to scale. Because one thing is to work on small groups. Some of our work with Program H, I'm almost done, involves having a control trial that has 3 separate components. One with just the group intervention, one with the group intervention plus a more media campaign, so to speak, and one with the control with nothing. And that is also helping us understand how you scale up, how you can build elements into the program to take it to the next level, which for us involves institutions. So different institutions have to step up and take responsibility for changing those norms, be it at school, a health center, or the media as an institution, or any type of institution. If we don't get to that, we don't change the structural aspects of the social gender norms that keep men reproducing violence. So that's what we hope to achieve, If at some point we could do it, maybe they can do it. And that's it. I hope it was fast.